Is your dog or cat over 7 years old? Well, this video could make a huge difference to their health. Hi, I'm Dr. Renee from The Natural Vets, an integrative vet practice on the Sunshine Coast, Australia. This is Shanti, my staffy and clinic mascot. It's hard to believe she's nearly 10 years old and already classified as a senior pet. And this is Sapoti, Shanti's favourite playmate. He's nearly 9, so despite his protests, he is also classified as a senior pet. Our role as your veterinarian changes as your pet ages. Of course, if they get ill, your vet should be the first person you call. But we're also here to help ageing pets like Shanti and Sapoti be healthy and happy well into their elderly years. At least every 6 months, Shanti has a thorough health check. I examine her ears, eyes, joints, skin and teeth. I listen to her heart and lungs and palpate her belly, check out any lumps or bumps. And I'm watching for any changes in her mobility or agility. Shanti also has blood and urine tests twice a year. This is like a window inside her body that lets me know how her systems are functioning. We check her urine, her red and white blood cells, and for any changes in her organ function like her liver and kidneys. We also run screening tests for things like heartworm, gut parasites, and her parvovirus antibody level on a less frequent basis. This way, Shanti doesn't have to be on as many toxic chemicals that she doesn't need, like obsolete annual vaccine boosters or worming tablets that aren't required. Sapoti gets the same treatment, which does mean car trips to the clinic. Thankfully, he likes the adventure, although he's less of a fan of the blood tests. So, what happens if we find something wrong? If the changes are mild, we may just recommend a diet change or supplements and another test in 3 to 6 months to monitor the changes. If the changes identified are more concerning, however, we may recommend further tests, like radiographs, or an ultrasound, a biopsy, or some advanced imaging. And sometimes surgical treatments may be necessary, for example, to remove a suspicious lump and get it tested at a lab. A veterinary dental treatment is often needed, and as pets age, their risk when undergoing anaesthesia increases. So we follow a careful pre-anaesthetic testing process prior to any intervention to ensure we can safely proceed. Sapoti needs a dental every year as he is a lazy chewer. The main goals of regular checks, including diagnostic tests, are to diagnose any diseases early so that we can start treatment, with the goal being to slow its progression. Without diagnostics, there's room for certain diseases to go undetected or untreated. And I want to be sure I can catch any disease process early, as my goal for Shanti is for her to live at least another 10 years, so that she can spend more time doing the things she loves: stealing the chickens' eggs, eating guinea pig poo, waterfall swims, and climbing mountains.